And then I looked at him and I went, but am I going to die? And his words to me were, not if I can help it. So I went for a regular screening appointment at my doctor's. Normally my screenings came back as abnormal. That was a normal thing for me. So again, this one come back as abnormal. I went to see the doctor. He sat me down and I looked at him and I went, I've got cervical cancer. And he said, do you understand the extent of what you've said, Carl? And I says, yeah, I've got cervical cancer. And he said, yes. And I says, okay, so am I going to die? And his words to me were, not if I can help it. And we discussed what treatment I'd wanted. And I said to the doctor, okay, I don't want your chemo or your radiotherapy. I want you to take away my cervix. And he was like, and he said to me, so you want a hysterectomy? They call it a radical hysterectomy. So I agreed and I said, yeah, that's what I want, is a radical hysterectomy, just please take away my cervix. So fast forward 3 weeks, that's the only time that was the length of time from diagnosis to operation, it was 3 weeks. So how do you digest that in 3 weeks? So I went into this operation almost blindfolded because I've never been operated on before. Never had any operations. So I walked into hospital. They took me down for surgery. And I remember I couldn't stop crying. For the love of the money, I could not stop crying and I couldn't understand why I was crying. And my Macmillan nurse passed my room and she come in, asked me how I was. I said, I can't stop crying. Why can't I? And the words she said to me was, we've taken away your baby bit, so it's like you've had a baby, but you haven't got a baby to hold because we've taken them bits away. So you're still we've spiked all them hormones of you having a baby, but there's nothing for you to hold anymore. If I was offered the HPV vaccine, I would have had it, but it wouldn't have gone on to anything else. So it wouldn't have gone on to cervical cancer. For me, cancer research is, again, it's one of them things that it's vitally important. It's, cancer research is going on all the time. If it wasn't for cancer research, it probably wouldn't have come about the HPV vaccine stopping the virus from growing. I feel that cancer research helped me. It will help others in the future. And it needs the more research that goes into it, the better in my eyes.